Did you hit play? Okay. So I'm Megan Moore, and I'll be giving a presentation to my colleague on our national patient safety goals, which the Joint Commission comes out with. They establish national patient safety goals in order to identify problems in healthcare and emphasize focus on these goals to improve patient safety and care. So this PowerPoint is going to focus specifically on the National Patient Safety Goal, which is preventing infection through hand hygiene. And I've put a link in the PowerPoint where you can access that specific goal. So this chosen goal, I'm going to further explore preventing infection through hand hygiene. Let's see, as outlined by the Joint Commission, use the hand cleaning guidelines from the CDC or the WHO, which stands for World Health Organization, or the Center for Disease Control. And they set goals for improving hand cleansing, kind of clinical guidelines that are standard across the board to use in any practice or clinical setting. And those can be found at the Joint Commission website. I've also provided a link for that. So I would say hand hygiene remains one of the simplest and least expensive interventions that healthcare workers can provide to protect patients. However, a lack of compliance leads to costly care and poor patient outcomes. So this is not part of the PowerPoint, but I thought it might be fun to kind of just give a little bit of a background, some of the history. So this is hand hygiene can be contributed to a doctor named Semmelweis, and all the way back in 1858, he noticed that women giving birth, that there was a difference in the mortality rate between women that were taken care of, or midwives giving birth, versus the doctors. And so when you looked at that comparison, the women that were dying under the care of physicians were passing away at a much higher rate. And he found out the reason for that came to be because those physicians would also conduct autopsies, and the conclusion that he drew, or the hypothesis, was that these physicians were performing the autopsies and that they would get these pathogens on their hands and then take care of other women, and it was just spreading these diseases where the midwives did not perform those particular autopsies. And so he found out that just simply by washing your hands made a huge difference in the decline of mortality for these women. So you can look at the specific numbers, but it was a pretty drastic difference. So I think initially that idea was dismissed and maybe even ridiculed, but we now know today that washing your hands is the best way, the least expensive, and the easiest thing that you can do for your patients. And I think a lot of times people, they're too busy, or they forget, or they overlook that, or the flu shot, things like that. Those are great interventions, but the absolute number one way to prevent infection and spreading these diseases is washing your hands. So let's see. What are the currently accepted CDC guidelines for hand hygiene? And again, you can access the CDC website for more thorough guidelines and more in-depth detail. This being a PowerPoint presentation, it's bullet point specific, but there are two methods that the CDC outlines. One is alcohol-based sanitizers versus soap and water. So according to the CDC, alcohol-based sanitizers are more effective for reducing germs on hands of healthcare providers. When your hands are visibly dirty, alcohol-based hand sanitizers are used. The next would be soap and water. When hands are visibly dirty, when known or suspected exposure to C. diff, known or expected exposure to norovirus, before eating or after using the restroom, soap and water. You would definitely want to wash your hands with soap and water. So that is the CDC, like I said, hand sanitizer versus soap and water. So the guidelines for when and how to use hand hygiene before eating, before and after contact with the patient, after contact with blood, body fluid, skin that is not intact, or wound dressings, contact with inanimate objects such as medical equipment, when hands are moving from a contaminated body site to a clean body site during patient care. I think that's very common to be taking care of maybe wound care, and you're doing that, and a lot of nurses just go on to the next task without taking the time to wash their hands in between doing those tasks. I know personally I have experience, I'm sure you do too, with you're just so busy, you have your hands full, and you're just going along these tasks, and it just slips your mind, doesn't occur to you. You need to wash your hands in between performing different tasks for your patients. So let's see. The first research article I looked in was an assessment of hand hygiene practices of healthcare workers. The purpose of this study was to assess the compliance of healthcare workers with prescribed methods of hand hygiene. So those prescribed methods are likely the ones that are outlined by the World Health Organization or the CDC. So in this study, the method was an observational cross-sectional study. Compliance was monitored using a hand hygiene observation tool that was developed by the World Health Organization, and that can be found accessing this link that was provided on the PowerPoint. The observation took place over a 60-day period and was conducted by a non-identified observer used for monitoring compliance. Obviously, people will alter their behavior if they know they're being monitored. I know I do. I think everybody does. So this was a non-identified observer in this study. The results of the study were the discrete observer recorded observations of the hand hygiene. 10 staff members were compliant before touching the patient. 165 staff members were not compliant. 48 performed hand hygiene after touching the patient. 128 staff members did not wash their hands after touching a patient. 91 staff members were observed to perform hand hygiene before an invasive procedure, and 71 did not. So the conclusions drawn were the article concluded that overall compliance with hand hygiene was low, and subsequent education and follow-up is recommended to improve the outcomes for a patient. So that was the conclusions drawn by this particular research article, and the numbers were kind of overwhelming. The amount of people that were not compliant with something, like I said, as simple as washing your hands when taking care of patients. The recommendations were in-services, education, and follow-up, continuing to assess compliance. This is kind of hard to see. You're probably not going to be able to see it on the video, but you can just see very clearly the red column reflects the people that were not compliant with hand hygiene procedures versus the blue that were. And you can see just they're not even close. The difference is pretty pronounced. So that was kind of surprising even to me. I thought it might be 50-50 but it's pretty overwhelming. And again, very, very simple intervention that can be provided for patients. The second article that I looked at was Hand Hygiene, the Case for Evidence-Based Education. The purpose of this research article was to review and demonstrate that using evidence-based guidelines regarding proper hand hygiene is effectively reduces contamination rates and improves patient care while reducing costs, making proper hand hygiene a priority in the medical setting. So again, this is one of the Joint Commission's or National Patient Safety Goals that is a priority, and I cannot emphasize enough how easy it is. It's just something that it's so as far as preventative things that can be preventative, one of the least expensive, easiest things that we can do for our patients. So that is a priority and one of the goals listed. Let's see, the research article cites that hospital-acquired infections affects 1 in 11 patients. It increases mortality by 13% and lengthens the patient's hospital stay, by an estimated 2.5 times longer stay in the hospital. The article cites that 80% of staff dressing wounds infected with MRSA carried this organism on their hands for up to 3 hours. By contrast, immediate hand washing with soap and water nearly eliminated the pathogen. So you have, like I said, the study found that, carrying this pathogen up to your hand for up to 3 hours, think about how many people or patients you come into contact with in 3 hours versus just washing your hands, eliminated almost immediately. So that's huge. 40% of patient-nurse interactions showed transmission to healthcare workers' hands of Klebsiella, even with contact as slight as touching a shoulder. Hand washing also eradicates the organism. So even if you're not doing anything invasive, just touching patients, inanimate objects, things you don't think about, you're carrying those pathogens on your hands. The article conclusively shows that proper hand hygiene is paramount to protecting patients in all healthcare settings, greatly reducing the number of preventable infections. And again, I want to emphasize, these are preventable. These hospital-acquired infections are preventable. Once again, this article supports that the root cause may be a perception that hand hygiene is not as important as other tasks performed, and emphasizes education and more hand washing stations as an intervention. So the interventions here for our patients would be to make sure that there are enough hand washing stations set up. Education is always huge. This article also emphasizes the education and services, handing out handwritten materials, posting things that are visible, or interventions that I would like to implement in my healthcare setting. And again, making sure that these things are accessible and available. I always carry a little hand sanitizer bottle in my pocket. I have it all the time. I have it with me all the time. And I try to clean my equipment in between patients with alcohol sanitizing wipes between every patient. Now in the hospital, each patient, they all have their own equipment in that room. Sometimes those things get moved in and out, and it's important those things be cleaned. So let's see, where am I? Right here. And here's another picture. It's hard to see on the video in the PowerPoint, that just kind of shows the statistics and the effects of hand hygiene on reducing these infections. And again, it's pretty significant. The last article number 3, back to the basics of infection control. The article focuses on infection prevention through hand hygiene, highlights the importance of the correlation between hand washing compliance and the decrease in infection. Hand hygiene has been supported over and again through evidence-based research to decrease preventable infections and reduce cost of care and length of stay for the patient. This particular article discussed the 5 moments for hand hygiene as an intervention to care. These are these are hand hygiene before you touch the patient, before clean or aseptic procedures, after body fluid exposure or risk, after touching the patient, and after touching the patient's surroundings, anything, bed sheets, IV pumps, inanimate objects, anything. So, and I think it's obvious to us all. We try to wash our hands when we walk in the patient's room. We try to wash our hands when we walk out. That's kind of just a given. But again, when you're working with the patient, and I know for me, and I think it'll highlight somewhere else in the PowerPoint, sometimes you walk into the room and you have your hands full. So maybe you're not even washing your hands when you walk into the patient's room. You got your hands full of supplies. So the summary of all this research is the National Patient Safety Goal of preventing infection through hand hygiene has been supported and thoroughly documented and supported in evidence-based practice. The research articles chosen demonstrate an issue with non-compliance and proper hand hygiene. The cost of these preventable health-acquired infection varies by infection and is estimated to be between 142 million and 4.25 billion. Let's see, have another slide, another picture that goes with the estimates of the cost, what it costs for a patient for these hospital-acquired infections versus what might the cost would be saved just by washing your hands. So let's see. I think the contributing factors for non-compliance are poor placement of dispensers. Those have to be readily available. So that's one intervention that I would personally like to implement in my healthcare setting, is making sure that I know for myself, again, I have one of those alcohol-based hand sanitizers in my pocket, but making sure we have those and passing those out to all members of the healthcare team and patients too, and providing that education as well. Compliance data is not recorded or reported accurately in hospitals, and sometimes I can understand that it may be difficult to draw a health an HAI directly back to, well, this person didn't wash their hands, but it has been documented and research articles support that. Insufficient or ineffective education. Like I said, people walk in with they have their hands full. The perception that hand hygiene is not needed if gloves are worn, and distractions of healthcare workers, and they just simply forget. They have so much going on, passing meds, procedures, patients, acute situations going on. So there's a lot more things just up front and center in their mind than, oh, let me stop and I need to wash my hands here. But just trying to implement that is part of just making it become more routine. So my interventions, like I said, would be in services, providing education of how this benefits patients, and not just patients, but healthcare workers too. I think human nature is if they see that something benefits themselves, they're more likely to comply. So you see, you have these germs on your hands. A lot of times people, they don't have the time, they can't take days off of work. They go into work sick, so make sure you're washing your hands is protecting you as well. And just having certain times, outlining as part of a routine. Obviously, when you walk in and out of a patient's room, we're washing our hands. But written education, passing out the alcohol wipes and sanitizers, and then just following up. I think continuing education, not just putting it out there once and say, hey, this is a problem, this is how we need to address it, but periodically, maybe quarterly, going back and just reassessing, getting feedback from people, and looking at the numbers and seeing if it's having a decrease. So obviously, when hand hygiene was first introduced and it was recognized as something that does prevent infections, the mortality dropped drastically, and people really implemented that and recognized how important it was. But Again, I don't know if part of our culture is to overlook that, and we have antibiotics and all these other things, and but I always tell my patients, you know, the number one thing you can do, the best thing you can do to prevent getting sick is washing your hands. Flu shots are great. There's always antibiotics. All these things are great. Wash your hands. That prevents, you know, that is the number one best thing that we can do for ourselves and our patients. So interventions to apply to clinical practice to achieve this national patient safety goal, based on the research, clearly established low compliance with proper hand hygiene leads to poor patient outcomes. It's a high cost burden on the healthcare system. And again, it's astounding how preventable it is. Education, emphasizing the importance, and I think I've already addressed this, anyone entering the patient's room, anyone involved with patient care, and that might be people that don't think they necessarily are touching the patient, people that bring the food in, you know, food service workers, custodians, even doctors. They, you know, even if they're not physically touching the patient, you need to wash your hands. You're touching other things. You need to wash your hands when you come in and out. Okay. And ongoing assessment and education is key. Workers may feel that the critical task in front of them, hand washing, is mundane. They don't perceive the very real consequences of the issue, and do not see it as a priority in light of everything else that is going on and must be addressed. They may view this goal as something they already know, you know, duh, I need to wash my hands. But evidence does support low compliance and root causes that need to be addressed. So that is my presentation on the importance of hand hygiene, and like I said, in my own healthcare setting, I will be trying to implement that through education, the PowerPoints that I've shared, and getting those little hand sanitizer bottles just so I can pass out to employees and patients too. I know I have one on me, but just to get it out there for everybody. So, and that is it. Thank you.